So if you patients are listening to this webinar, and if your transplant hepatologist is approaching you for a biopsy, even if your liver enzymes are normal, I can tell you 10 years ago, I was also skeptical. Is it really justified? In our experience, in 80% after a protocol biopsy, we discuss each biopsy, we change something. Either we slightly increase, or we reduce immunosuppression, or we adapt this, or we think about this. So it's really worthwhile knowing what's going on in the liver. So that's my recommendation. It's really changed the landscape. Just to remind that you also have to undergo vaccination to prevent infections. So really make sure, obviously, that you follow guidelines. But what I want to highlight here, and again, the question whether sometimes we forget this. So it's not only that you guys, you liver transplant recipients, should receive your transplantation, but also talk to your family. It's important that also household members of transplanted patients should receive all recommended vaccinations, for example, including yearly influenza vaccination, even if they are not matching the criteria for the general population. But it's very important because obviously you are also maybe exposed to pathogens in your family. And that's, to me, a very strong statement because we forget this. And then the last point is obviously, hopefully you received a transplant, you survived for 5 to 10 years. And then the worst thing that can happen that you would develop another maybe non-liver related cancer. And cancer screening works. And that's, to me, the most important point. Colonoscopy is really something that is very well implemented. I don't know. I just put it here. This is our local screening in Hanover. So we do a yearly abdominal sonography. We do skin cancer. We send them to the gynecologists, our patients to the urologist. We do our every 5 years colonoscopy, maybe even more frequently. And obviously, if there's an inflammatory bowel disease, more often. HCC screening in post-transplant really depends on the cause of transplantation and the individual risk. I don't know. Are there any other general recommendations in Romania, Speranța, or do you do special different?
We do the same. I just add to some of them ENT screening for cancer. So for at least the ones that were transplanted for alcohol or the ones that smoke, I also recommend to them going to an ENT.
I took it out here, but we had it in my list here. Very good. Teresa?
We perform also CT scan for lung cancer.
Lung cancer, a lung cancer screening is, you do it regularly. We didn't have it previously. We have the lung cancer screening. The low dose CT is in Germany recommended for lung cancer screening since 2024. So you can do this, but this is, it's important that people shouldn't forget.